Hi, I'm Dr. Kirstey Holland. I'm going to show you the clearest path to become vital and vibrant. What is the process and what does the protocol look like? Let's look at the symptoms that were missed, the diagnosis you deserve, and the healing plan that really works. I've done this myself and I've taken care of countless women in my clinic in Melbourne, Australia for the last 26 years. I'm a university-trained doctor of traditional Chinese medicine with a double degree in acupuncture and herbal medicine. I'm a practitioner of environmental and nutritional medicine and a functional medical practitioner. I'm also a trauma-informed health mentor. I use the incredibly powerful diagnostic tools of 5,000-year-old traditional Chinese medicine, and I marry those with modern functional testing in my clinic in Melbourne, Australia. I have done this exact process myself, and I've taken countless women, I live by this, and I've taken countless women through this process in 26 years in my clinic in Melbourne, Australia. Just like Maslow's hierarchy of needs, I call this the hierarchy of healing because your biochemistry, in fact, wants to heal in a particular order. So let's go through this. It's a three-part process. The hierarchy of healing starts with repair, which is part one. So we have repair. In repair, we focus on gut and immunity. Approximately 80% of your immune system is in your gut. Part two is rebalance. We rebalance your hormones. And then part three is reclaim. We reclaim your metabolic health for good. In repair, we focus on you being calm and settled. We calm down your biochemistry and your nervous system and you settle into a new way of being. And then in rebalance, we focus on you being steady and balanced. And finally, in reclaim, you are vital and free. Most women start here. This is a really good place to start. This is not a good place to stay. And sadly, a lot of women that come into the clinic are already in survival mode. The saddest part of survival mode is that women generally blame themselves. You know, it's my fault, I'm too busy, I'm too stressed, I'm doing something wrong, I must be eating incorrectly, I'm not moving enough, I'm eating too much, my sleep is not good enough, it's because I've taken on too much. Often, unfortunately, women in this stage have been gaslit or they've gaslit themselves, they're super confused, and what worked in the past is no longer working for them. They often come in saying, Dr. Holland, I used to do X, Y, and Z, and I'd be back in my skinny jeans in no time. What worked for you before is no longer working because you are in a biological transition state. So depending on where you are at for your starting point, this could take 3, 6, or 9 months for you. And really what we need to do is get you from where you are now to a very different place. We need to get you to the top of that mountain with the appropriate care. And with 26 years of experience, I help you break through this model. People get stuck if they don't have a plan. I'm going to show you how to become your most vital, vibrant self. When you're looking at this process, just tap into yourself and see what you feel needs work for you. So what we want is vitality and a beautiful life. So in the center of this triangle is vitality. Excellent. We want a beautiful body, a beautiful brain, and a beautiful soul. So like, for example, Renee, Charlotte, and Carla, 3 of the patients in my clinic. Renee was an absolutely beautiful mum in her 40s, but she had a secret. By the afternoon, her belly would be so bloated that she looked 6 months pregnant. She was so severely constipated that she couldn't actually move her bowels herself and had to rely on enemas. And then the problem with that is that she would actually have the opposite experience as well and couldn't control her bowel motions. She was so anxious, this would drive anyone nuts. It would make anybody super, super anxious when you can't trust your body like this. And believe it or not, when you have an inflammation in your belly, you have an inflammation in your mood and your mind. So your gut health actually impacts your brain. She couldn't sleep. She avoided being seen, even by her husband. This was really impacting their relationship as well. So she wasn't wanting to go out, she wasn't wanting to get dressed, she wasn't wanting to go out in the evenings because she felt so uncomfortable and was in such severe pain. And unfortunately, her doctor told her that her blood tests were normal. They were in fact normal, but the right testing wasn't done for Renee at this point. So with Renee, we had to heal, seal, and repair her gastral mucosa, so those tight gap junctions in her gastrointestinal tract. We supported her digestion, and in no time she was moving her bowels on her own again and felt confident about this. So life started to become easier for her. That was actually one of the things that she reported back to us. And this is the perfect example because it shows that when your biochemistry is on your side, you can trust your body and life does become easier. She was even confident enough to apply for a new job. Charlotte was a nurse working night shifts, newly married to the love of her life and desperate to have a baby. She had undiagnosed prediabetes type 2 or insulin resistance, major reflux, polycystic ovarian syndrome, bloating, irregular menstrual cycles, and her nervous system was an absolute mess because she had an extremely domineering mother-in-law that was causing major stress in her relationship with her husband. When she came to me, she was on 5 pharmaceutical medications. This is a woman in her late 30s, desperate to have a baby, who has lost all confidence in her body to ovulate appropriately. So with beautiful Charlotte, we healed her gut, we identified her food triggers, which was huge for her. We corrected her circadian rhythm disruption. In our society, unfortunately, we have a huge darkness deficiency and a lightness deficiency. She started ovulating again. She established strong personal boundaries and the highest levels of self-care. I'm here to tell you that in perimenopause, we need to take care of ourselves in a way that we never have done before. This is really a biochemical roller coaster and it's a transition state. All of the symptoms are brain symptoms. We need to desperately protect our brain. So that high level of self-care was imperative for Charlotte. Within weeks, her insulin resistance reversed. No more type 2 diabetes. Her gut settled down completely. She was able to come off all of the pharmaceutical medications that she was on. And weeks later, her OBGYN confirmed that she had ovulated. With Charlotte, this is a perfect example of a social stressor that was really disrupting her nervous system. So this domineering mother-in-law in her home, creating havoc with her nervous system. So we really do need to investigate our biological, our psychological, and our social health. Carla desperately needed an individualized plan. She was doing absolutely everything right according to health influencers online. She found a happy hormone plan online. She was eating chia seeds and flax seeds and chickpeas and lentils and beans, and she couldn't understand why her weight continued to go up when she was so compliant. She was inflamed and she was in severe pain. Unfortunately, she was also constipated. This is actually very common, and her joints were achy. She said she felt like the Tin Man as opposed to buttery and supple. So Carla asked me, she was like, how can I be doing all of these things right and feel so awful? With Carla, it was absolutely imperative for us to identify her food triggers. We got the foods that were not working for her out of her diet and we rectified her food plan. We did the appropriate foundational testing and had a look at the data and created an individualized precision medicine plan for Carla. Carla's inflammation and her pain went away. What she said to us was, I can't believe how beautifully my body responds when I actually give it what it needs. So what we want is vitality, the beautiful life. We want our body, our brains, and our souls back. And the 3 things that we need to focus on are biology, psychology, and your social experience. When your biology is working for you and not against you, and your psychology is on your side, you have a beautiful mindset. Your biology impacts your psychology, and your psychology impacts your social experience. Once your biology is working for you and not against you, and your psychology is on your side, you have a beautiful mindset. You are able to create more beauty in your life and have the beautiful life. I'm actually here to tell you that when your biology is working for you and not against you, your psychology is on your side, you are able to create more beauty in your life. Things like filling your home with flowers and making an effort. And believe it or not, these are cherries on top, and libido sometimes falls into this category too. So in order to have vitality, we need to focus on our biopsychosocial health. You know you have a beautiful life because your biopsychosocial health is congruent. Your biology is supporting your psychology, your beautiful mindset, and your beautiful mindset and your psychology is supporting your social experience. That's how we know we're completely vital, because we have this beautiful congruency between our bio-psycho-social health. If this interests you, this is a conversation worth having. So comment the word ready, ideally on Instagram, Facebook. You can email me the word ready and I'll know that you're interested in working with me. After almost 3 decades in clinic, the problems that tend to come up for women are usually boiled down to these 3 things. Women come in and they say, what's wrong with me? I don't know what to do and I don't have the right support. So there is no diagnosis, no plan, and no real support. So now we need the solutions. We need to focus on the symptoms that were missed and the diagnosis you deserve. So we need an accurate, individualized diagnosis. Where there was no plan before, we need a healing plan, an individualized precision medicine healing plan that actually really works. Beautiful. So what we do next is talk through the interventions and we can assess where you're at, kind of like a traffic light, whether this is a red, whether this is a yellow, or whether this is a green for you. So my question is, have you done the comprehensive assessments? And when I mean comprehensive assessments, my question to you is, have you done a hormone assessment? Have you done a mind, body, brain assessment? Have you had a look at your metabolic health? So have you done comprehensive assessments to actually see where you're at? I want you to think about whether you're green or good, whether you're yellow or red. You know, I might have a problem in that area. So my question to you is, have you done a full health history? Have you done the gut assessments? Have you done full hormonal assessments to tell you where your progesterone, your estrogen, your androgens, your melatonin, your cortisol is at? Have you done full metabolic assessments to tell you whether you're metabolically flexible or not? These are the full health histories that I'm looking for. So that could really, you know, for some women, they may have in fact started with those. So let's give that a yellow. Next is a perimenopausal symptom tracker, for example, or a PMS tracker. Tracking is really important. In perimenopause, because it is a symptoms-based diagnosis, the symptoms at particular times in your cycle are so incredibly important when trying to figure out this accurate diagnosis so that we know which hormones are doing what at what point in your cycle. So tracking is imperative. Have you used a perimenopausal symptom tracker, for example? Most women actually haven't tracked when they come to see me, so I'll give that a red. And next is testing. I'm talking comprehensive testing for a woman between the ages of 35 and 55. That looks like full thyroid panel, TSH, T3, T4, reverse T3, thyroid antibodies. Have you got a full FBE, not just iron, but hemoglobin and ferritin? Have you tested your LH, your FSH, estrogen? Have you tested all of your hormones except for progesterone on day 2 of the cycle, and progesterone somewhere between day 19 and 22 of the cycle? If you haven't done comprehensive testing, that is an issue. So for the interventions here, it's the full assessments, the tracking and the testing. So many women haven't done all of the testing, so I can give that a yellow because they might have some tests, but not all. And then when it comes to your healing plan, we really need you to be aware of the status of your biopsychosocial health. It's so important to understand that our biochemistry really does support our psychology. You know, when we have an inflammation in the gut, for example, you know, your biochemistry is not right in the gut. So often women have an inflammation in the mood and the mind, and that impacts their psychology. And when you're feeling blah and down, that certainly impacts your social experience, for example. Or you could be living in a relationship that's not serving you anymore. I actually had a woman come into the clinic and she honestly wanted me to, she was desperate to be vital. She was, you know, overweight, stressed out. She had prediabetes. She wanted to be so vital, but when it got to the point where we were discussing her full health history and trauma and the ACE score, she told me that she absolutely hated her husband and they were no longer sleeping in the same bedroom. They were sleeping in separate bedrooms. Not that that's a bad thing. I think we have to save our sleep sometimes. But the point is that she wasn't going to leave him for the children. But I really do believe that your social experience has got such a huge impact on your biology. We can't ignore the fact that health is biopsychosocial. When it comes to the healing plan, we really need to have a look at your status or the status of your biopsychosocial health. So it's imperative for us to understand that how when our biology is working for us and not against us, it really does impact our psychology in such a beautifully positive way. We're able to have this beautiful mindset. And from a place of a beautiful mindset, you're able to bring so much beauty into your life and into your social experience, into your family dynamic, into your home, into your relationships at work. I really don't think it's possible to be ultimately vital if our social experience is not supportive of our biochemistry, because all of these things impact one another. Your social experience is going to impact your biology, it'll impact your psychology, and vice versa. Your psychology impacts your biology and your social experience. There's a biodirectional pathway between your brain and your gut, for example. So that's one of the places that we have to focus in order to have a beautiful mind. When we have an inflamed gut, we can have an inflamed mood and mind. So next with the healing plan is, through all of the assessments and the tracking and the testing, we need to know exactly where you are in this process. So here's the process, and we've got to look at, do you start with repair? Do you need to repair your gut and your immune system? Do you need to rebalance your hormones? Do you need to reclaim your metabolic health for good? And I'm here to tell you that you cannot skip a phase. You cannot start to rebalance your hormones if you have a dysbiotic microbiome and you're not detoxifying properly. Your liver, your large intestine, your immune system, and your gastrointestinal tract is not working. It won't be sustainable hormone balance. This is actually one of the major issues I see in my clinic all the time. Women go for hormone balancing prior to gut repair. And it's so difficult to balance your blood glucose and your metabolism, for example, if you haven't repaired your gut and rebalanced your hormones first. So for example, with Susan really needed a plan and needed to figure out her process so that she could repair her gut, rebalance her hormones, and then reclaim her metabolic health for good. And Susan's one of those people who just plugs and plays. So in the first 3 months, she repaired her gut. She was super, I don't know that I've ever seen anyone as compliant as Susan. I have some patients that are super compliant, some patients are 80-20. The more compliant you are, the faster you move through the process. And through your individualized healing plan, we need to develop your personalized protocol. So you've got your process and your protocol. And the protocol is the way that you run your N of 1 experiment, your N of 1 experience, your own personal trial. And you work out how to eat, sleep, move, think, connect, test, and prescribe. So with your individualized protocol, you are referring back to your tracking all of the time, so that when I'm supporting you or supervising your N of 1 experiment with exactly how you need to eat, sleep, move, think, connect, test, and prescribe to support your own personal biochemistry, we need to identify your food triggers so that you work out your own personalized food protocol, so that you're not confused or, all over the place thinking, should I do plant-based? Should I do paleo? Should I do keto? We actually establish your own personalized food protocol. And then we work out how much sleep you need. And through all of the tracking and the healing journal and the mood, pain, lifestyle, and food diaries, you start to really take note of yourself and what it is that you need. How many hours sleep? You look at a good day as opposed to a bad day, and you compare, like, what did I eat yesterday? I felt $1,000,000, And then you start to identify exactly how much sleep that you need. Some of our patients use an Aura ring to capture their data. I really do love you tapping in and getting a sense of whether you had a good night's sleep or not, and writing that down in your healing journal. We talk about and teach exactly what it is that you need to do in order to get an incredible night's sleep. And then moving in a way that you love. We need to work out exactly how much movement you personally need, depending on the movement that you love, depending on the movement that you want to do, in order to be as vital as you possibly can be. And then we really do need to check our psychology, and we need to work out how our thoughts are impacting us, how our beautiful mindset could support our social experience and our biology, so much more than negative thinking, for example. And then we need to look at the way we're connecting. Midlife can really be a time of huge transition and change, and it's really important for us to reconsider the way we connect to work, the way we can connect with our loved ones, the way we connect with our friends. We need to actually ask ourselves what we are and what we are no longer available for. So this is a really interesting time. So, focusing in on the way that we think and the way that we connect. And then, of course, doing the beautiful foundational testing from time to time, perhaps every 3 to 6 months, to see how the biochemistry and the data is changing in order to know what you need to do next with regards to the process. When you have graduated from repairing your gut, you can move into rebalancing your hormones and then reclaiming your metabolic health for good. Doing things like the GI 360, which is a comprehensive gut test, or the Dutch test, which is a beautiful hormone test, or wearing a continuous glucose monitor, for example, when you're reclaiming your metabolic flexibility so that you're in this beautiful fat burn and not in a fat store state. And then learning how to prescribe these gorgeous botanical, nutraceutical, and psychobiotic medicines. So when we're looking at the protocol, the process, and your biopsychosocial status, lots of women actually do get a sense of how their biology is impacting their mindset when we start to talk through it. And they also understand whether the job that they hate is good for them or not. So let's give that a yellow, for example. Women don't often know what to do. They often come in going, I don't know what to do. So that is where we need that beautiful healing plan that really works. So I'm actually going to mark that as a red. And then by and large, through the conversations, it's very clear that women are so confused as to how to eat, sleep, move, think, connect, test, and prescribe. So I'm going to give that a red as well. When it comes to the healing plan that really works, like for example with my patient Sally, she actually had a very good idea as to what she needed to do with regards to the way she needed to eat, for example. She was pre-diabetic and she had received a fairly good insulin-resistant eating plan, but it was very, very much the troubleshooting and kind of what to do when the plan wasn't working. Sally really needed support in getting back on track. We're human beings, we're not robots, so, we might not do things 100% all of the time. It's okay to fall off the wagon, and I'm definitely here to get you back on the wagon. I'm here to get you back on track. And that's what Sally needed. She didn't really know what to do when the plan wasn't working. So you need someone that can troubleshoot that for you. Sadly, most women don't have someone in the back that can help them with the troubleshooting. I'm sure, some women have some great encouragement from their beautiful husbands, for example, or their sisters or their besties. So let's put that as a yellow. And then they don't know what to do when the plan is not working. I would definitely say that I see reds there most of the time. I get to take care of women worldwide. All you need to do is follow the process and the protocol we create with you inside of the Vitality Clinic. So in summary, health is biopsychosocial. We need to repair your gut and immune system, rebalance your hormones, and reclaim your metabolic health for good, sustainably. This could take anywhere between 3, 6, and 9 months, depending on where you are in the process. And we need to work out exactly how you need to eat, sleep, move, think, connect, test, and prescribe to be your most vital, vibrant self. When you are vital and vibrant, you can be the best mum, the best partner, the best sister, the best lover that you want to be. You can live the life of your dreams. Whatever it is that you want to do, you can do it so much better when your biology is working for you and not against you. When you're vital and vibrant, you are confident, you are comfortable in your own skin, your energy lasts all day, way past 3 p.m. You sleep like the dead and you're back. As your health gets better, your life gets easier. 3 things happen. you become the expert. You become self-referenced. You have food freedom. You have exhaustion freedom. You have symptom freedom. Life gets easier and way more fun. So through this process, you've repaired your gut, rebalanced your hormones, reclaimed your metabolic health, and you've developed your protocol so that you know how to eat, sleep, move, think, connect, test, and prescribe. You have run your own N of 1 experiment and experience. You know what works for you, and you are the best version of yourself. This is lifestyle medicine. Food first, sleep, movement, thinking, connecting. These are very, very important things. So this lifestyle medicine moves with you and it evolves as you move through the process. Continuity of this self-care model is part of lifelong vitality. So continuity of care is imperative. So when you are finally vital, you have incredible levels of body literacy and you know how to take care of yourself. You are unconsciously competent in taking care of yourself. Once you've learned this, you don't have to think about it anymore. It becomes a part of who you are. This is your new lifestyle medicine. My teaching style is shoulder to shoulder. We walk side by side in this human experience with compassion and kindness. This is not some guru to student model. I learn from all of my patients all of the time. I am a forever student. I have a beginner's mindset and I absolutely love it. It is so freeing. I learn from my patients every day. I will offer my knowledge, my skills, and my experience, and I will help supervise your personal, individualized healing journey to get you to become your most vital, vibrant self. And I will hold you accountable. I want this for you. You deserve it. If this resonates, I'd love to take care of you inside my clinic. I have patients in my clinic that have actually been with us for years. They love the continuity of care and they love the way we take care of them. Change is the only constant and you are human, so life will throw different things at you at different times. If you can stay as vital as you possibly can, you will bring your most vital, vibrant self to your biggest challenges. So if you're ready, comment the word ready. Like I said, send me a message on Instagram, comment on any of my posts on Instagram, Facebook, send me an email just with the word ready. I will know that you've seen this video and we can get this going for you. Take it easy and have a beautiful day.